Not COVID patients, but those with injuries you'd expect here. Triaged briefly outside, most are now heading straight to the COVID-free or green zone.
We are definitely seeing an increase in the green patients that are arriving to the emergency department.
Matron Anne Broughton told me although COVID cases are declining, numbers of other patients have almost doubled recently.
It can be mentally exhausting and tiring for us all. I think, the need to sort of help our patients and get through this together as a team and for our community is really important.
That's very optimistic. I think if it was me, I'd be absolutely shattered.
Yeah, and everyone is shattered and exhausted as well, but I think we all know that we've got to work through this.
Despite their exhaustion, staff are quickly having to find ways to open up services again safely, with the spectre of a second wave of coronavirus hanging over them.
The emergency department is now a tricky balancing act between ensuring that there's enough capacity and staff to deal with the increasing number of patients here in the green zone, but have the flexibility to suddenly ramp it up in the red zone if there's an increase in COVID patients.
We are worried. It's a bit of the fear of the unknown, of knowing when it's going to happen, if it's going to happen. And we're already modelling, looking at what we do going forwards and how we utilise our space and our staff effectively. And as we said right in the beginning, we're adaptable and flexible enough to be able to do that for all of our patients.
Patients like Matt, who thought twice about bringing his daughter in.
We did think about it quite hard.
And are there anxiety levels, given that you're here now? I mean,
obviously yes, but then I sort of thought about the way that there'd be fewer people here because people would have a higher bar, a higher threshold with which to come. So, we thought about it, but I'm not that anxious.
As NHS Confederation warns, pressures on hospitals will remain immense, even without an escalation in COVID cases. Waiting lists are just one aspect that could help create a perfect storm.
I think it'd be foolish to deny it, but that COVID itself is, just one element, and then, all the massive knock-on effect that it's had with, people not seeking attention when they should, the, potential chronic problems from having COVID, and, yes, winter, another flu season, and, the potential for a second wave or anything like that. I think there's definitely kind of an anxiety around it.
The government insists the service will get the funding and resources it needs. But juggling all of this won't be easy. Today's warning also comes with a plea. Expectations must match reality. Emily Morgan, News at 10 at St George's Hospital in London.